very professional, and you don't have to wait long or anything.
I live down around Clear Lake, and come up here because it's like this place. I get first I get to pay cash, which is good for me. Share, and I get good quick service, and yeah, it's a lot cheaper than it used to be. You know, from what I'm paying a couple $100 for now, I used to pay a couple $1,000 for a couple years ago at other places. So yeah, it's real good. And for things.
Thank you.
This time kidney stone, one time prostate exam, PET scan, a couple of scans, different things. Come for yearly checkups. See how fast they are? And up and go. Okay.
He likes this place, like he likes his kidney stones. I had a CT with the what is it called?
Contrast.
With the contrast, and they charged me at the Mainland Hospital in Texas City almost $13,000. Actually, even my insurance refused to pay. Over here, it cost me $250. I've always received good care here, prompt service. I used to have years ago cancer, and I took the PET scans with a nuclear infusion, and it was always very good care, prompt care, and I was very happy.
I'm Diego Roldán. I'm the general manager of Houston Medical Imaging for the last 11 years, and it has been a pleasure to work in this company and grow from 4 employees to more than 60 employees. We care about patient care. We are happy right now to develop a new program that is called NTMI Medical Imaging, where we offer the patients the opportunity to have an imaging procedures at lower cost. There are patients in financial need, struggling to pay their own bills. They go to the doctor's office and they have the alternative with us. They can see 7 o'clock p.m. To have an MRI, for example, for $350. To have a mammogram for $70. We are proud of that. We are ready to give something back to the community. So that's Houston Medical Imaging, that's NTMI Medical Imaging, myself, 60 employees, Dr. Calderon, and a strong group of radiologists here in the
Hi,
city.
I'm a registered ultrasound sonographer. I've been working in medical imaging for 11 years. We do all types of ultrasounds, basically from head to toe, vascular, general ultrasound, OB, gynecology ultrasound. We also do thyroid biopsies, breast biopsy. I've been working here for 11 years and they treat me like family. I never want to go anywhere else. Everybody works well together and communicate very well. And we have several.
I work for Houston Medical Imaging. This is a Siemens scanner, a 1.5 Tesla, most scanners. Very high resolution. So it's a little bit more comfortable. I've been doing MRI a long time, and I believe that this is one of the best scanners I've ever had the privilege of working on. Houston Medical Imaging is a great company. We have several facilities, one in Richmond, one in Campbell, on Campbell off of I-10.
The MRI technologist at Houston Medical Imaging, do the MRI on one patient for it's a closed magnet, 1.5
Tesla Siemens high field MRI. It is a short bore MRI, so it's much more comfortable for the patients that are claustrophobic also. It's a high resolution magnet. We get great images in here. Most of the scans are approximately 20 minutes. I'm an MRI tech. I've been doing it for about 14 years. I've been here at HMI for a couple years and I'm really happy with that. Everyone here treats you like family, and that includes the patients when they come. I don't know what else to say. Are you doing okay? Yep. Okay, great. We're going to slide you in, okay? Close your eyes for a second. Okay, great. All right, we're going to slide you in. Are you okay in there? Okay, great.
I'm doing an MRI on a patient of the shoulder that had a previous arthrogram upstairs. So you can see better out on the sides.
It's a brand new machine. It's called a high field open MRI. It's very spacious in here, a lot of room for patients. It's open all on the side over here so they can see out when they're in there doing their pictures. We're getting very high resolution, sharp images. The doctors are very happy with them. We're seeing all kinds of patients for different reasons. Patients that can't lay on their backs may have to be positioned a certain way. With all the extra room we have in here, we have that ability to do that. The patients are very happy with it. compressors and chillers. We have to keep this room very cold. The equipment produces a lot of heat, and this is for the Hitachi system. We bring in cool water into a chiller that keeps the sensation CT/PET CT machine. The back part of the machine is the PET part, which uses radioisotopes. This machine is state-of-the-art. It's very fast. We can scan CTs in about a minute or under. It's very good for scanning patients with cancer. Since we can do this CAT scan and the PET in one, it saves the patient time, and they can get it all done here.
My name is Kim. I'm here to introduce a Hitachi Scenario 64/CT scanner. It is a very high-resolution, low-dose scanner. We can perform 3D reconstructions, cardiac scanning, CT angiography. This is by far top-of-the-notch technology. I've been doing this for about 12 years. This scanner is located off the Katy Freeway, the Campbell location.
No protrusion, period. No central canal or lateral recess stenosis, period. Foramen arcade, period. New paragraph T910, colon. No protrusion, period. No central canal or lateral recess stenosis, period. New paragraph impression, colon. New paragraph number 1. 13-degree convex left, photoscoliotic curvature at T910, period. There are no segmentation, comma, fusion anomalies, period. New paragraph number 2.
Gamma camera. It's used in nuclear medicine. The patient is injected with radioisotopes. It's especially good when detecting problems with the heart, the lungs. The patient will lay on the table. The camera then rotates around them. This is the camera here and
Dr. David A. Gonzalez. I'm a cardiologist, and I've been with the Houston Medical Imaging for the last 12 years. The procedures that we take care of here in the Houston Medical Imaging is the stress testing, echocardiograms, and
Hi, my name is Kim. I'm the cardiovascular technologist here at Houston Medical Imaging for 11 years now. I love working at Houston Medical Imaging. Here we are sound machine that we use to do ultrasounds of the heart, ultrasounds of the veins, and ultrasounds of the carotid arteries. And 9 megahertz transducer. We use this transducer to do ultrasound of the carotid arteries and the veins. This test here is actually a carotid Doppler. And for the exam, we place the transducer on the neck, and we slide the transducer on the neck, and we're able to locate the carotid artery. This is here, the little circle here. And we use this to check the velocities of blood flow that's going to the brain.
I'm Novia. I've been working for Houston Medical Imaging for almost 4 years. I'm very happy working with them. We have excellent co-workers and excellent radiologists. We have a very
tabletop like this, or you can use it as upright. So patients won't have to lay down. You can do all your images upright. You're also able to rotate your eyes, such as injections, which like arthrograms, ESIs, diaphragm enemas. You're able to move the machine around the patient if they're laying down, so the patient doesn't have to worry about.
Radiology technologies, especially this mammography. I'm working for NTMI for a couple of years, and I'm so happy to working for this company. The machine we do have for mammography is Novation Siemens, and we usually start with 4 to 5 images. It depends of the shape of the breast and size of the patient. We start with RCC. We position the patient right over here. RCC stands for cranial color right over here. We position the patient here, and then we press it out with this paddle. And as soon as we finish by right side, we go same thing with the left, and right after that we're gonna do left MLO, which is oblique view. We go with 45 degree, and we do the left first. We ask the patient to here, hold this bar, and we control our technique. By adding the number, and it depends of the size of the patient, We check the number we're gonna have.
My name is Randall Stanowan. I'm a radiologist. I've been working here at Houston Medical Imaging since 2002. I am a working guy. I read studies every day. I do biopsies. I take care of patients, but in the meantime I'm also the CEO of Houston Medical Imaging, so I do get involved on the administrative side.
Leslie Wacom, a portable upright 215. Impression number 1, there are moderate to large bilateral pleural effusions, period. There is bilateral lower lobe consolidation, period. Paragraph, contact. There are no comparison studies, period. Paragraph, the heart is normal in size, period. There is
As an example, in this particular case, this is a routine study that was ordered. It was completed at 12:10. It's currently 1:55, so less than 2 hours. The report is now been faxed to the doctor's office. It's available online. Images are available online for review. So here in the case of a routine study, less than 2 hours. Certainly I can do a turnaround time in just a few minutes and have the report available for
example, patient tech sends a patient to CareStream, our PACS, and radiologist doesn't see the patient. It could be that that's miscommunication with the PACS, that the service went down, it didn't transfer. They call us to investigate to see what's going on. If the patient is transferred and merged to a different patient, or if it's just, let's say, didn't even transfer. That's one of the functions. You know, outside physicians, when they're sending studies to us, they call and say if studies are not going through. It could be internet connection, it could be VPN, it could be many other things. So pretty much just giving support to techs, outside centers,
or
trying to fix
a new patient portal which is called MyView. And MyView is a mechanism by which patients can access not only their reports but also their images. Now, in order to facilitate communication to the physician, in order to allow them time to review the report and communicate with the patient, we have a 7-day time delay on the reports. But the images are immediately available once the patient registers and once the patient has received the login word, which is automatically sent to their email. So indeed, within 7 days the report is available. Immediately the images are available for the patient to review or for the patient to share with one of their accessible providers. It uses a code called HTML5, which is Advanced Internet Code. So it's accessible on your computer. Sometimes patients will have to install what's called a Google Frame onto their Internet Explorer. But it works with Firefox, it works with Safari, so you can look at it on a Mac or a PC. You can look at the images and the reports on iPads. And there's now a new release with the software where physicians and patients will be able to pull up the information on their iPhone. The Google phone works as well, so what we're leading to, or what we're developing, is a web-based access system for not only patients but doctors that can be looked at on a number of platforms, from PCs and Macs down to iPads and indeed smartphones.
The pulmonary arteries were normal in caliber without evidence of filling defect, period. No destructive osseous lesion is identified, period. Chest wall and soft tissues demonstrate no focal abnormalities, period. Visualized portions of the upper abdomen or within audio from Houston Medical Imaging. I'm pulling a patient Ross, and on a CTA of the chest, it's a limited exam, but I don't see any large PE. Okay. Thank you. Bye-bye.
Hi, I'm Dr. Jim Kane. I'm one of the staff radiologists here at Houston Medical Imaging, and I came here about 12 years ago at the invitation of Dr. Marcus Calderon, who created Houston Medical, good service to offer. So we developed our interventional pain management service, which involves doing spinal injections primarily for people with back pain and herniations and pinched nerves in their back, things like that. So I guess that started about 7 or 8 years back, and we're very proud of the service we've developed, the opportunity to help patients with back pain and musculoskeletal pain. I'm really proud of really proud to be a part of Houston Medical Imaging, and I really do feel that it is the premier outpatient imaging center in Houston at this time, and that's been in large part to the vision that Dr. Marcus Calderon had, and then later Dr. Stenowan had, and all of the radiologists here. I think when I came on board there were 4 of us, and now there's 15 or 16 of us. It just seems like we keep growing, but I think because of our attention to quality and because of our concern for the patients and our concern for good service, not to mention our relatively low prices, I think we just keep growing, and we're approached all the time about the opportunity to provide radiology and pain management services.
Medical imaging, we are the beta test site for CareStream. So we are at this time, the only people in North America that have the MyView patient portal. It's being set for general release, and that will be installed in different hospitals and outpatient facilities across the nation. But right now, we're kind of on the cusp of development. One of the things that I've always felt strongly about is the fact that information technology, and I think this is something that Dr. Calderon shares my passion with, information technology is very key to providing improved health care. One of the other initiatives that Houston Medical Imaging is involved with is integrating with the local HIE. What is an HIE? HIE is a Healthcare Information Exchange. And the Greater Houston Health Connect is an organization which is sponsored by the local Harris County Medical Society. It's a mechanism by which hospitals in the medical center, outside the medical center, indeed in a 22-county area, can begin to share patient information. Houston Medical Imaging is in the process of integrating their patient database with the HIE. This will provide a HIPAA-compliant way for patients to share their information should they go to the hospital, should they end up in a different doctor's office, whether it be in Houston or in one of the surrounding counties. So HIE is one of the waves of the future in which we're going to be able to share patient information, provide better care to the patient, better communication between doctors and facilities, and hopefully avoid performing those unnecessary repeat exams that often happen when patients end up in the emergency.
My name is Angelina Deshtabani, and I've been a senior coordinator in scheduling for the past several years. I started with HMI when I was about, well, it's been about maybe over 15 years. I was able to go through most of these departments. I learned quite a bit, and now I'm a senior scheduler. Management of scheduling either starts by the referring doctor, when the nurse comes in, or calls in, and we get the information from the nurse, from the patient information to insurance information to documentation of procedures that we have to do. The other way is that the doctors fax over the information through a fax server, which gives us the opportunity to go ahead and get the information from the fax server and call the patients immediately and try to get them scheduled onto our scheduling.
Houston Medical Imaging, may I speak with Chi Lu, please? Hi, this is, was calling in reference to your appointment for today at 12.
My name is Mohammed. I work in the MRI department for Houston Medical Imaging for about 29 years. I'm very happy to work here. I enjoy working here. I got a lot of friends.
We strive to do at Houston Medical Imaging is to provide high quality care at a low price. And we recognize that there are a number of patients who do not have access to insurance, who may have very high deductible policies, who frankly cannot afford to pay for this high quality imaging. And so nighttime medical imaging is a mechanism that we've developed, kind of a subcommittee or subcompany, so to speak, to provide inexpensive but yet maintain the high quality of the modalities, of the radiologists, of the information system, and thus provide our patients with a value type of care that they might not be able to afford otherwise. So nighttime medical imaging, in summary, is we're providing discounted care without compromising quality, providing a high value to our patients, and then helping them get the studies that they need. We do ask that patients be a little flexible in their scheduling, so hence the term nighttime medical imaging. They might end up with an evening appointment or an early morning appointment so that we can accommodate our regular patients. But we think it's a nice mechanism to provide very cost-effective care for those patients that can't afford to go through the regular channels of insurance. Highest quality ACR or American College of Radiology accredited equipment with all of our patients. So whether you are a standard Houston Medical Imaging patient or a nighttime medical imaging patient, you're going to be imaged with the same care on the same equipment and be given the same diligence when we interpret your study. Nighttime medical imaging, we provide the same services that are provided by Houston Medical Imaging. This would include MRI, CT scan, nuclear medicine, ultrasound, vascular ultrasound, X-ray, bone DEXAs, and even mammo. And what we try to do with mammography is just provide a good low-cost entry cost point for our patients and get them worked up as inexpensively as possible.